I hear you fine.
Okay, great. Well, I think we're going to go ahead and get started. And welcome to our first virtual open enrollment meeting. This is definitely going to be um, probably a new trend that a lot of meetings will take place this way. We did test this out, so some of you participated in the test last week, and it worked pretty good. Just want to go through a couple of quick reminders. One, if you're not speaking, please be sure to mute your microphone so that we don't have feedback and picking up background noises. Also, if you have a question or a comment, I think everybody's view should be the same, but up in your far right-hand corner, there's a little quote cloud that says chat, and you can type in a question there, and we'll make sure that those questions get answered before the end of the presentation. And I'm going to go ahead and start by introducing our team from Clemens Company, who will be doing the presentation and going through the information. Everyone should have gotten some documents ahead of time. Hopefully you were able to print those out to make it a little bit easier to follow along. And I'm going to start off by introducing Scott Clemens. And Scott, as you guys know, is not only a board member, but he's been our broker for about 5 years now, helping us coordinate our benefits and helping us with selections of plans and carriers. Michelle Matt and Chip Gramlin are his left and right hands. They help him and assist Goodwill with this process, getting ready for open enrollment and making all the decisions we have to make. And then, of course, we have Scotty Scott with us today, and Scotty's going to tell us a little bit about Aflac benefits like he always does. And so we're pretty much going to follow the same format that you've been accustomed to in our face-to-face meetings. And again, if you have any questions, you can type them in the chat box and we'll make sure they get answered. And Scott and Chip, you guys want to kick it off?
Okay, thank you, Tamara. Good morning, everybody. This is Scott. And so, you know, it's been a tough couple of months. We've faced significant challenges, and I think the pandemic has probably been harder on Goodwill Industries than most other employers. But we're glad a lot of you are back working now, and this presents new challenges. As Tamara mentioned, we're now doing open enrollment meetings virtually. This is only the second time we've done this, but it may be a trend that may continue because of the pandemic. But I also mention that because we're bringing you pretty good news today. What you're going to find is that there's only a modest change in some of the health plans and the cost. There's a modest increase in the cost. For all the other benefits, there's no cost increase. So we're bringing you pretty good news today. As you all know, we're on today because this is open enrollment. I want to stress that because the significance of open enrollment means this is the only time during the year you have an opportunity to come on the plan or come off of a plan or change from one plan design to another, add dependents or take dependents off, those kind of things. There are a few exceptions to that. So you'll see on there on your documents, there's some what are called qualified life events. The changes where there might be, if there was a marriage or a divorce, that opens up the opportunity to make changes. If there's a change in job for somebody in the family, which affects your rights to benefits, birth of a child, that kind of thing. Those are the times, the only exceptions to making changes other than right now during open enrollment. Now, to be clear, this open enrollment is what we would call a passive enrollment. So if you're on, say you're on the dental and you've been on one of the health plans with Florida Blue and you don't want to make a change, you don't have to go into Infinity HR and make that change. But we always recommend that it's a good idea every year to look at your benefits, remind yourself of what you have, and think about whether you want to make any changes. If you are going to make those changes, that period of open enrollment, the time when you can make that is May 26th through June 9th. All changes have to be made by the 9th. If they're not made by then, you'll have whatever you have in place right now. And the great thing about what Goodwill has done for you is you look on this document, you see that you have a very broad array of benefits. You have health, telemedicine, dental, vision, and for some of you, life and AD&D and disability. We have the EAP program and other voluntary benefits that Scotty's going to talk about a little bit later on. So you're very fortunate that they have worked hard over the years to build a benefit plan that should take care of all of your needs. Now, to get into the details of this, what I'm going to do is turn it over to Chip Gramley, part of our Clemens Company team, and he's going to get into the details of each of the plans so that you can think about which plan is the best for you and know how to use it in the most efficient way, the cheapest way when you have a need for care. So with that, I'm going to turn it over to Chip.
Thanks, Scott. Good morning, everybody. So as Scott mentioned, there are no changes. However, keep in mind that if you do make an election change during open enrollment, such as changing from one plan to the other, that effective date of that change will be July the 1st. So if you had a dependent, they're not going to come on the plan, even though we're closing that window on the 9th. Even though that window closes, they won't be on the plan. Or if you had a dependent, or if you remove someone, those changes won't take effect until the 1st of July. So we're going to jump into the medical plans. If you're outside the CHP service area, these are the plans that are available to you. They're all very good plans with Blue Cross Blue Shield of Florida. At the top of the page, you'll notice in the yellow banner, it says Blue Cross Blue Shield Blue Options Plans. Just like to always remind you that Blue Cross has several different networks. So when you access care, it is your responsibility to make sure that you're accessing care in network, to make sure that you receive care at the lowest cost based on the plan that you're enrolled in. Blue Options is a specific network. So when you do go to the Blue Cross website, or if you call us, you want to mention that you have a Blue Options plan, or if you call your provider, ask them if they are a Blue Options provider, and your provider should know the difference between the keep in mind, I know that we have people that are in the Georgia locations. Blue Options exist in Florida. So if perhaps you're in Thomasville and you travel to Tallahassee for care, you want to make sure your provider's in the Blue Options network. If you access care in Georgia and you ask them if they're a Blue Options provider, they may not know what you're talking about, but that's okay because the rule is pretty simple. When you're outside the state of Florida, you only have to ask the provider if they are a Blue Cross provider of the state that you are in. So if you're in Georgia, you go to Atlanta to receive care, you're perhaps just in Thomasville right there locally, you would just say, hey, are you Blue Cross Blue Shield of Georgia? If the provider says yes, they're automatically considered Blue Options, and you're automatically considered in network for your plan. You do have out-of-network benefits. They are less, and they're also tracked separately. So if you do go out of network to receive service, just know that that'll be additional deductible, additional copays, additional coinsurance, and additional max out of pocket. So you could have a lot more money out of your pocket if you're choosing to go out of network. So of course, if you can, try to stay in network. Again, when we have the Blue Options plans, you'll see at the bottom of the sheet, and we don't need to forward it there, Michelle, but at the bottom of the sheet, your lab work for outpatient lab work is still required to be done at Quest Labs. That has not changed in, I think, the 5 years that we've been managing these plans for you guys. So I'm going to start with the plan on the far right, Plan 5360. I will tell you that when you see the rate changes, they are minimal. This plan had a slight rate change around $5, $6 per pay period. The other two plans basically were rate holds. So we're going to start with the benefits are listed down the left side of the page. You'll see where there's the plan deductible, co-insurance, your out-of-pocket maximum, things like that. And I'm just going to walk through each plan and what the benefits are and how it would affect you. So under Plan 5360 on the far right, you'll notice that it has a $1,500 deductible, and that is per person covered under the plan. So if it's just you that's enrolled, you have a $1,500 deductible. A planned deductible is basically the amount that you have to pay in certain situations before the insurance company helps you starts to help you pay. So a good example would be on this plan, if you are admitted to the hospital, you would have to meet that $1,500 deductible. Whatever remains on your bill, Blue Cross would pick up a portion of that, and you would be required to pick up a portion of that. There are a limit of 3 deductibles per family. So if you're covering just you and your spouse, you would have a deductible for each person. If you're covering more than yourself and your spouse, so maybe you, a spouse, and a couple of children, so a full family, we limit the deductibles for the family to 3 for a total of $4,500. But again, we track each person individually. So if only one person gets sick, and this applies to all of the plans, if only one person gets sick, you can have some limits there where you're not going to have a lot of exposure. After you meet your deductible, and only in situations where you're required to meet a deductible, you will then have to pay what we call co-insurance. That's just where the insurance company splits the bill with you. Under Plan 5360, Blue Cross will pick up 80% of that remaining bill after the deductible has been met. You will be responsible for 20% of that bill. So let me give you a quick example. If you're admitted to the hospital and your bill is $10,000 for that hospital stay, after your $1,500 deductible, which means there would be about $8,500 left on the bill, you would be responsible for 20% of that $8,500. Blue Cross would pay the remaining 80%. Every plan has what's called an out-of-pocket maximum. Think of this as sort of a large bucket that captures every dollar you spend towards receiving care, except for the premium that you pay us to have the plan. So in my example, when you paid your $1,500 deductible, it also goes towards your out-of-pocket maximum. When you pay the 20% coinsurance I mentioned, that also goes towards your out-of-pocket maximum. The out-of-pocket maximum also captures any copays that you pay throughout the year for doctor's visits, imaging, etc. It also captures any prescriptions that you pick up and pay for with your prescription drug card. So under this plan, the out-of-pocket maximum for one person is $5,000. So again, that does include that $1,500 deductible. So once you've met your deductible, you have about $3,500 that you would have to meet. Once you meet the $5,000, so if you're having a bad year, a lot of doctor's visits, perhaps some expensive prescriptions, a hospital stay, once you've met $5,000 out of pocket, you are done for the year, and Blue Cross would pay 100% for the remainder of the calendar year. I think I failed to mention that. We track all of your benefits. Even though you're signing up in July, we track all of your benefits on a calendar year. So if you're new to the plan and you come in July 1 and you meet your deductible in the later part of the year, November, December, we do start you back at 0 January the 1st, as though you have met none of your deductible. And then that benefit plan will run on the calendar year. If you have a family enrolled in the plan, so you or your spouse and children, your maximum per family out of pocket is $10,000. Under this plan, when you go to the doctor's office, a primary care physician, so that's general practice, family practice, internal medicine, or pediatrician. If you have children on the plan, it's a $25 copay. Anytime you see the word copay, you pay that flat dollar amount. You do not have to meet deductible. You do not have to pay coinsurance. You pay that flat dollar amount to receive service while at the physician's office. If you go to see a specialist, dermatologist, cardiologist, urologist, gynecologist, etc., you would pay a flat $50 copay under Plan 5360. If you go to visit an urgent care center, it's a flat $5 copay. Let me give a little advice. Urgent care centers can often do things that emergency rooms can do. So they may be able to fix a broken bone, perhaps give you some stitches, things like that. Certainly less expensive than going to the emergency room. So we encourage you to kind of work in an order when you get sick. And let me walk you through that order. If you're enrolled in the Teladoc benefit, so you would have the telemedicine benefit, and you get sick, we would of course encourage you to use the telemedicine benefit first, because there's no cost to you for that office visit. It's a virtual visit with a doctor. Your second option would be to go to your primary care doctor at $25 or to a specialist if necessary at $50. If you can, go to urgent care. So if you're having that stomach pain or that immediate need, go to an urgent care where they can take you as a walk-in and pay a $55 copay. And last but not least is emergency room. So if you have a true emergency and you need to go to the emergency room, just don't use it as your doctor for just kind of that everyday need. You are going to have to meet your deductible of $1,500 and pay 20%. All three plans have a preventive care benefit, also known as a wellness benefit. And we're going to spend a little bit of time on wellness in a few minutes. But under the plan, the preventive care benefit basically has three parts. One, each person enrolled in the plan can receive an annual physical at no charge. So you will not be required to meet a deductible, pay coinsurance, or pay a copay. The second part of preventive care or wellness is for ladies, and that's for receiving mammograms. Whether it's a routine mammogram or a diagnostic mammogram, it's covered at 100%. So if your doctor says, hey, you need to have a mammogram, as long as it's the old school, uncomfortable mammogram, then it is free to you. I will say if they ask you back for a second or third visit to review, and they want to take a look at maybe having you do an ultrasound, that would not be covered under 100% benefit. It would be subject to the plan that you're under. And then the third part is if you're over age 50 and you have a routine colonoscopy, those are covered at 100% also. And let me define routine. Routine means you are at the age, so over 50, you're not exhibiting symptoms. You just happen to go to your doctor and they say, hey, how old are you? You say, I'm 52. And they say, have you had a colonoscopy? It's basically a routine screening. If that's the situation you find yourself in, that procedure will be covered at 100%. However, keep in mind that there is medication that you typically take the day before. You will pick that up with your prescription drug card, and it's possible that you would have a copay for that medication, even though it's associated with the free service. Those are available to you one every 10 years unless you're deemed high risk, and then it's more often than that. So it could be every 3 to 5 years with Blue Cross's approval. When you go to the hospital and you're admitted overnight, you do have to meet your $1,500 deductible and then pay 20% of the remaining bill until you meet your $5,000 max out of pocket. When the doctor sees you in the hospital or visits you in the ER, guess what? They're going to bill you separately, and those are also subject to the deductible and the 20%. If you have outpatient surgery done, whether it's at a surgery center or outpatient at the hospital, it is deductible plus a 30% coinsurance rate. Then as we skip down, you'll see imaging. That's like advanced images, MRIs, CT scans, PET scans, etc. Those are a flat $450 copay. So remember, when you see copay, you pay the flat dollar amount to receive the service. You do not have to meet deductible or pay coinsurance. And at the very bottom of the page, you'll see that your lab benefit with Quest is a $0 copay. So when your doctor prescribes that lab work in your outpatient doctor visit, you do want to go to Quest to have that lab work done at no cost, or they can submit it to Quest to be read, and that will be at no cost also. Let me jump over. We'll come back to prescriptions and how they apply to each plan in just a moment. Plan 3900, this one has a $1,500 deductible per person also. Be aware that $1,500 deductible, there's no family limit. So if you have 5 family members, each could have their own separate deductible. It's okay, it matches the other plans if you have less than 3 in your family, but once you get to 4 or 5 or 6 family members, and if they're all covered under the plan, everyone is subject to a deductible. However, there is a family maximum of $12,700 out of pocket total for the year for the entire family. Also be aware, after you meet your deductible under plan 3900, the coinsurance is 50-50. So in my example of a $10,000 bill where you're having to meet deductible, we would then split the cost with you after your deductible 50-50. So you're paying half the bill and Blue Cross is paying half the bill. This plan has an out-of-pocket maximum of $6,350, so about $1,350 more per individual enrolled in the plan. Again, there is a family limit of 2 of those per year. The office visits under this plan are $35 copay for a family doctor, $50 for a specialist. You lose the copay at urgent care. You do have to meet deductible and pay 50%, just as though you would on the other plan when you went to the hospital. Same for the emergency room, but again, we still encourage you to use sort of that, excuse me? Okay, still do encourage you to use the order that I recommended. Telemedicine first, primary care and specialist second. Use urgent care, even though it's still subject to deductible and coinsurance, their cost that they've negotiated with Blue Cross can still be less than the emergency room. And again, use your emergency room as last resort and truly for emergencies. And again, it's subject to the $1,500 deductible and 50%. The preventive care benefit is the same 3 parts: annual exam, mammograms for ladies, and the colonoscopies for anyone over 50. So I'm not going to go through that benefit again. Under Plan 3900, when you're admitted to the hospital, this plan has an actual copay instead of making you meet deductible. So that means if you have a $10,000 hospital bill, you're admitted for 2 days, you're only going to pay $1,500 if you're in an option 1 hospital, $2,500 if you're in an option 2 hospital. What's the difference? Blue Cross has different financial arrangements with different hospitals, and we either label them as an option 1 or option 2 hospital. You won't know that ahead of time. You can look that up online, and we can tell you. So if you're going to be admitted to the hospital, you can ask if they're an option 1 or option 2. If you go outside the state of Florida to receive care, they're automatically going to be, as long as they're Blue Cross of the state that you're in, they'll automatically be considered an option 2 hospital. Under this plan, when your doctor sees you at the hospital or at the ER, of course, they're going to also charge you that deductible and 50% of the bill. And you can also see that for outpatient surgery, we have separate benefits depending on whether you go to a surgery center or outpatient at the hospital. Outpatient at the hospital is a copay of $300 or $400. When you go to an ambulatory surgery center, these are these standalone surgery centers, you will have to meet your deductible and pay coinsurance. Your imaging under this plan, such as MRIs, PET scans, etc., are subject to the deductible and 50% coinsurance. And again, under Plan 3900, your lab work at Quest is free. Keep in mind, if you're admitted to the hospital, that lab work is not required to be sent to Quest. That typically would fall under your hospital contract, and it would be subject either to the deductible or to a copay, depending on the plan that you're enrolled in. Under Plan 5905, and again, the rate on that plan did not change. Under Plan 5905, slightly higher deductible, $7,000. We did bring in a plan with a high deductible. It does have copays at your family doctor and specialist. It does have preventive care. It does have the free lab work. But the reason we wanted to put this plan in place is we want you to have an opportunity to have some basic coverage at a very low cost. And you can see for an individual to be covered under this plan, it's only a $25 copay. $25 premium per pay period for each employee that's enrolled in this plan. Covering spouse and children and family, of course, costs more. This plan, Michelle, help me out on the coinsurance. That's 70% after deductible.
Yes.
That's the employee's portion.
No, I'm sorry, you're correct. It should be 30.
Yeah. Okay, so just on what the plan pays is Blue Cross would pay 70% after you meet deductible under this plan. You would be responsible for 30%. So slightly higher than Plan 5360, a little better than Plan 3900 as far as splitting the bill in those situations. Your max out of pocket is higher on this plan, which means there's a little more risk on you and a little less risk on Blue Cross, and that's $7,350. So think about it this way. Once you've met your deductible, you're pretty close to meeting your overall max out of pocket, which means then you would be at 100% for the year. Under this plan, when you see a primary care doctor, it's $50. The specialist costs $75 per visit, which matches up pretty close to what we're seeing on the CHP side. Urgent care visits after deductible are 30% coinsurance, and we would pay 70%. Same for emergency room, same order of care: telemedicine, family doctor, specialist, urgent care, and then use emergency room as your last resort. Same preventive care benefit, same 3 parts: annual exam, mammography or mammograms, and colonoscopies. Under this plan, when you're admitted to the hospital, there is no copay. You would have to meet that $7,000 deductible and plus pay 30% of the bill until you had met your $7,350 out of pocket. Same for hospital or when the doctor sees you in the hospital, the ER. Same for outpatient surgery, whether it's done at a surgery center or outpatient at the hospital. And the same goes for imaging. All of those require you to meet the $7,000 deductible, which basically means you'll be paying for the service until you've met that deductible. And of course, you do get your basic lab work for free. Michelle, let's change to the next page and look at prescriptions.
Sure.
So let's start back over at the right. Under the higher cost plan where the rate jumped up just slightly, plan 5360, you're going to have generic drugs available to you for a $10 copay if they are maintenance medications. So if you have, a $10 copay for a 30-day supply, that $10 copay covers any generic medication and that is covered under the plan and is for a 30-day supply or less. For $25, you can have a 90-day supply mailed to your home. That's the mail order benefit you see listed there for $25. In Blue Cross's world, we break brand name drugs into categories. We have preferred and non-preferred. And under this plan, if you have a preferred brand name drug, and what's the difference? The real difference here is we just have a list. And there's some drugs that we put on our preferred list. There's some we put on our non-preferred list. So you have access to that list by going online. You can certainly contact Blue Cross or contact our office. And we'll be happy to look up that drug if you are taking a brand name drug. Blue Cross does require you to take generic if one is available. Unless the generic doesn't work for you, your doctor can deem it medically necessary that you take the brand, and then we may approve that. We do have a process you have to go through in order for us to approve it often. The preferred brand name drugs are $50. The non-preferred brand name drugs, you would pay $80 for that 30-day supply. And again, you can do mail order under that plan 5360 for the preferred drugs and the non-preferred brand name drugs at $125 or $200. Blue Cross does cover specialty medications, and it's depending on what tier it falls in, there's different cost shares. So we can discuss that individually if you need us to go over that with you. Plan 3900, the plan that had the $1,500 deductible, et cetera. It also has a $10 generic drug coverage. That's for a 30-day supply. However, pay close attention to this. There is limited coverage for brand name drugs. So if you take a lot of brand name drugs, you have a list of brand name drugs that you're interested in taking, make sure that you look at the list that's covered under Plan 3900, because it is an abbreviated list of preferred brand name drugs, and we make you pay 20% of the cost of those drugs. So if Blue Cross has negotiated that drug, and let's say it's a $500 drug and we negotiated it down to $300, then you're going to pay $60 for that drug. If it's a non-preferred drug or it's not on our abbreviated preferred brand drug list, it will not be covered. So let me repeat that. If it's not on our preferred brand name abbreviated list, or if it's a non-preferred brand name drug, it will not be covered. So pay close attention to that list before you buy this plan. Plan 5905 looks similar to the way 5360 works. However, there are a few little add-ins. It still has generic drugs for $10 for a 30-day supply. Mail order, you can still get that generic drug 90-day supply for $25. However, if you're going to have a preferred brand drug, you have an $800 additional deductible that you have to meet. So under this plan, you remember it has a $7,000 deductible. It also has an additional $800 deductible for brand name drugs. So once you meet that separate $800 deductible for that brand name drug, then you can get your drugs at $60 for preferred brand name for a 30-day supply, or mail order 90-day supply for $150. Keep in mind, this plan is really designed for kind of that low to moderate user to give you some basic coverage. So it's not designed for the person that takes 5 or 6 different brand name drugs on a monthly basis. Also, if you'll notice in the bottom right-hand corner, it's very small, and I apologize for that. We always encourage you, as I'm sure you've seen the commercials. I've seen a lot of the commercials during the quarantine for GoodRx. You always have a right to use GoodRx and the discounts that they provide when you go, and that's just being a smart consumer. So we encourage you to download their app onto your phone and always check it when you're using your prescription card. Okay, Michelle? So Blue Cross has a lot of services that they provide, but if you're not accessing them online or via the app, then they are going to really not be of much use to you. So right here are a couple of ideas and things we want you to consider doing. The first is go to floridablue.com and or download their app. You go to the App Store and find the Florida Blue app. It'll give you 24-hour access to your benefits, claims information. I will tell you if you have a claims issue and you call us, we're going to ask for this information. You can actually pull up your ID cards so that if you don't have one that you carry in your wallet, you can carry it on your phone. There are cost comparison tools. It's just a great tool to use to kind of keep you informed on how your plan works and to get the most benefit. Also, on number 2 here, we have saving money on prescriptions. Just want to point out that Walgreens is a preferred pharmacy with Blue Cross. Surprise, surprise, the price for prescriptions is different at every pharmacy, and we negotiate that with them. So a drug that may be less expensive at Walmart may be more expensive at CVS, but Walgreens is where Blue Cross has negotiated, we think, the better deal, and we prefer that you try there. We also, at the bottom there, Michelle, I want to point out about CareCentrix. For some services, Blue Cross uses third parties to sort of manage like medical equipment and things like that. Make sure if you're getting that CPAP machine, getting your supplies, those types of things, go through CareCentrix to make sure that it's covered under your plan. Next screen. Also, Blue Cross has a service called Know Before You Go, and if you'll just run down to the bottom of that page, Michelle. We do negotiate it individually with every provider. So one provider might provide an x-ray at $50 and the same x-ray down the street might be $120. The only way that you're going to know that is on the left there. It says click, call, or visit. We would encourage you to either go online and research that using our website, or the easiest model is to call our care consultant team. This is not listed on your card, so I do want you to write this number down or print out this page. That 888-476-2227. You can use that number. You call care consultants. You tell them what service you're looking for example, an x-ray, and they can give you 4 or 5 locations and the cost of that x-ray under your plan. So if you're having to meet a deductible, for example, on an advanced image, why not use that service so that you get the lowest cost? Just being a smart consumer. Michelle? Next page. So Teladoc is one of your benefits, and we've really pushed this benefit. This is using your phone or computer to receive medical care. As you know, you can Skype or FaceTime with your physician. We certainly encourage you to download the app. I will tell you, during this COVID crisis, calling in, there have been longer wait times, but scheduling an appointment using the app has been very easy. As you can see on the right, you can get quality care for conditions such as sinus problems, bronchitis, allergies, cold and flu, UTIs, respiratory infections, etc. And this is really a great tool for getting to see a doctor without you really spending a lot of time and incurring a lot of cost. Typically, they're available 24 hours a day, 7 days a week, 365 days a year. I will tell you, obviously, during the COVID crisis, the wait times have increased. After we get through this coronavirus issue, I'm hoping to see those wait times go back down. They used to be almost simultaneous. You would call and they would call you right back, or a licensed physician would call you back. So in this case, you would be talking to a licensed physician in the state you're calling from. So if you're on vacation and you're in North Carolina, then a doctor that's licensed in North Carolina would call you back. Obviously, if you're in Florida or Georgia, it's going to be a Florida or Georgia physician that calls you. And here's the best thing about telemedicine using Teladoc. They can prescribe medication. So you're going to enter some information when you set up the app. You'll choose a pharmacy that's your local pharmacy of choice, and they will submit a prescription electronically, which you can then use your health insurance card to pick up that prescription. Remember, this is also a service offered under your Blue Cross plan. So if you do not purchase the separate Teladoc benefit that's available for about $1.63 per pay period, if you do not purchase a separate Teladoc benefit, you do have Teladoc available for anyone that's enrolled in a health plan with Blue Cross Blue Shield of Florida. That benefit, or that call, when you call in, there's typically a $10 charge. So you have to have a credit card available. However, due to the circumstances subject to COVID right now, they have waived that cost until July 31st. So if you did call into Teladoc and you were not enrolled in the separate Teladoc that we have offered through Goodwill, then you would be able to access it via your Blue Cross plan, and there's no cost until July 31st. After July 31st, you will experience $10 for that call. When you call in, if you have the voluntary that you're paying $1.63 for, you do need to make sure that they know that you have a no copay Teladoc service, and it does cover you and everyone in your household. So even if they're not covered under your health plan, if you do sign up for the additional Teladoc benefit, even if they're not covered under your health plan, they will be covered under the Teladoc benefit. So you can use that for your spouse or your significant other, if you're not married, if they live with you, or their children or your children, if they live in the household. And it's a great service. I've used it a lot. It saved me a lot of money because I'm not taking the time to leave work. I'm also not having to pay a copay when I go to the doctor. So great benefit, and they do send that prescription to your pharmacy of choice. If you do not have health care and you're signed up for this plan, you can ask them to provide you with a generic prescription. Michelle? As you know, at Goodwill, we've offered these two dental plans for years. These are with Guardian. It's called Dental Guard Preferred. You have two options. You have option 1 or option 2. Option 1 is the NAP plan. Option 2 is the value plan. The cost is the same. So as I've said in years past, you're not making a buying decision based on price, because the cost for you and your family is the same as it's been every year, and it's the same for each plan. So there's no rate change here. What you do need to keep in mind is your doctor in network? So let me give you a quick rule of thumb. If your doctor is not in network, then you want to sign up for the NAP plan. If your doctor is in network, you can sign up for the value plan and actually receive a little stronger benefit in network. So we're going to, on this plan, when you go to the dentist that's in network and you're under that NAP plan, then they're going to pay 100% for preventive. They cover 80% of basic, which is listed below. It breaks out what preventive services, but basic services would be things like cavities being filled, having a root canal done, anesthesia, things like that. And for major services, that's the big expensive stuff. We split the cost with you 50-50. You'll notice at the top there is a calendar year deductible for single and for family. It's $50 per individual covered under the plan. We do limit it to 3 per family, and it's waived for preventive. So if you're going to have your teeth cleaned a couple of times a year, you're not going to have to meet that deductible. And if you're in network, we'll pay that at 100%. If you go to the dentist and they say, hey, you need to have a cavity filled, or if you have to have major work done, you will have to meet that deductible 1 time per calendar year. Your maximum benefit under this plan is $1,250. This works a little different than health insurance. You do have to, basically what this means is that you have $1,250 of Guardian's money to spend when you go to the dentist. So if we pay for 80% of your cavity, and let's say it's about a $200 expense, then you would have about $1,050 left on your plan maximum. Once you spend the $1,250 of our money, you are done for the year. We will not pay any more, and you would have to pay those additional costs. There is an orthodontics benefit on both plans. It's only $1,000, and that's a lifetime benefit. That's not a per calendar year, and we pay that cost at 50%. What that means is, if you go to your orthodontist or your child goes to the orthodontist, and they need to get braces, and that cost is going to be $200 a month, we will pay $100 of that $200. You would pay $100 until we have spent $1,000, and then we are done. The orthodontia age limits, if your child is age 20 or younger, so basically between 18 and 20, if they're a non-student, they would still be covered for the orthodontics benefit, but after age 20, if they're still a non-student, they lose that benefit. But if they remain a student, then they have that coverage all the way up to age 26. Under the value plan, it works basically the same. In network, you do have a little stronger benefit for cavities and root canals and things like that. It's covered at 100% instead of splitting the cost 80-20. Major services, you get a little more money from Guardian. It's at 60% as opposed to 50% under the NAP plan. You do have the deductibles you're subject to for basic and major. The plan limit is still the same, $1,250, and the orthodontic benefit works the same. Where you need to be careful under the value plan is if you go to a dentist that's not in our network, we operate off of a fee schedule. So what that means is we've already negotiated a lower cost, so we will not pay as much. So you could have more out of your pocket if your doctor is not in network. Michelle? Superior National Network is your vision network. This in the past has been Advantica. There really is no change to the company. They were taken over by Superior. So your plan has not changed. The rate has not changed. So this is the same vision plan that you're used to. You get a vision exam one time per year for $10. So you go to your doctor, they examine your eyes. If nothing has changed or you don't need a prescription yet, or need glasses or contacts, then you're out the door for $10. If you do need glasses or contacts, you're going to pay an additional $10 copay. That's a material fee, and that would allow you to get either glasses or contacts. And when I say glasses, let's break that out. You have lenses for your glasses once per year. You can have contacts once per year, not both. You have to pick which one you want. If you do sign up for the contact lens benefit when you're at your optometrist, they're also going to charge you an additional $30 for what they call a contact fitting fee. You get up to $95 of retail value for contacts, or you can pick lenses for your glasses. What's covered is single, bifocal, trifocal, progressive, etc. Frames. Frames are only covered every 2 years. So the way this would work is if you're enrolled in the plan for July 1 and you go in August, you would pay your $10 exam fee, material fee, and you'll say you picked out glasses, you could get lenses and frames. The next year, you would go back, $10 for the exam. If your prescription changed, you'd pay a $10 material fee. You would get new lenses, they would put them in your existing frames. The third year, $10 exam, $10 material fee, you could pick out frames again in that third year. So think of frames as every other year, lenses and exam as every year. Also keep in mind, this is used once every 12 months. So if you use it in September, you can't use it again in January. You would have to wait until the following September or later to use that plan. Here's your rate sheet. Just kind of scan through that. You can look at that at your leisure, but you can see that the rates on Plan 5360 jumped up around $5 per pay period. These are per pay period rates. You can see the Superior Vision, the rates there did not change. and then you can see the Guardian dental rates, which did not change, and the Teladoc voluntary costs, which did not change. One of the benefits that's provided to you via Guardian is an employee assistance program. And I just want to take just a second, kind of as we've gone through this crisis, there's a lot of help available for employees at no cost to you. Michelle, do we have that other sheet that we can bring up?
I do. This is technical difficulty, so bear with me.
Okay, so while you're doing that, let's talk about this for a second. Right here. So Guardian calls this work-life matters, and there's a lot of different services. If you'll scan up under this employee assistance program that you can use, you can call and talk to a consultant, and they can provide you help with healthy living, stress management, parenting support. You've got that difficult child and you're struggling with, how do we manage this? You can actually talk to a clinician about that. Legal issues, will preparation, managing debt, etc. You'll notice that I highlighted under help with health, diet and fitness, and overall wellness. I actually spent a little bit of time on the website this morning, and there are some really cool videos. Not only do they have cool videos on different exercises that you can perform, there's articles on healthy lifestyle and healthy living. Some of them can be very specific. I mean, there was a video on emotional eating. I saw on CNN the other day that a lot of people, when they feel stress, especially in times like this, when they're at home, they may call it like the COVID-15, where they're gaining an extra 15 pounds while they're sitting at home because the worry or the concern or the stress of not working, etc. And they eat to fill that void. Just a lot of really good issues are covered using this employee assistance program. So I would encourage you to take a look at that. So go back to the top of the page, Michelle, or you could actually look at the bottom, but at the top, you can see this IBH, Integrated Behavioral Health. That's who Guardian has teamed with. And if you go to their website at the bottom, it's ibhworklife.com, and you can see how to log in. I would really, really encourage you to use that site. Scott, you have any comments on wellness you want to add?
Yeah, I wanted to add a few things to that. A while back when Chip was talking about the health plans, he spent a lot of time talking about the wellness visits, the annual physicals you can get. I just want to stress to you the importance of taking advantage of that. It's free to you. And, it's kind of a difficult subject to talk about, but if you imagine cancer, we know statistically that people who go get a regular annual physical, if there is the emergence of cancer, they catch it early. So it's easier to treat, much more successful to treat. Whereas people who don't, oftentimes it's caught at a very late stage where it's more difficult to treat. And so we encourage you there are other conditions that you can catch early that make a big difference if you know ahead of time, and you can begin to tackle that. So I really encourage you all to take full advantage of it. We also want you, I'm glad Chip brought up the EAP program, really would like you guys to talk to them about overall wellness. They can give you great tips on establishing exercise routines, establishing the right type of diet. That can make a difference for each of you individually, but if we're all beginning to adopt those habits, remember that we're all sort of in a boat together. All of us who are in this, you that are in this health plan, you're all like in a boat rowing together. And if you're working together to keep each other healthy, then we can begin to bend the curve and try to keep the premiums down in years to come. So I encourage you to take advantage of that. Thank you, Chip.
Okay, Michelle, we're going to move over to Scotty Scott and let him talk about some additional benefits via AFLAC.
Hello, everybody. I appreciate y'all's patience and time today. I just got a few things I wanted to point out here. the Aflac, get the facts. It's different than your regular health insurance that pays cash directly to you. Some of you folks already know this, but there's others hopefully that are paying attention. The plans belong to you. They don't belong to the employer. It simply means that you can, if your career takes you someplace else, you can take your Aflac benefits with you. They're yours. The premiums don't change because you leave. The rates don't go up. And we try to stress everybody to sign up online, get registered. That way we can pay your claims. We have the 1-day pay. You can move on there. And most of the benefits are going to help you there with deductibles. Everybody's got co-pays. And the biggest thing is we pay cash directly to you. You can use the money however you see fit. Even if you ended up going down to Moffitt for cancer treatments and things like that, your major meds don't give you money to travel with and loss of income. So that's why we pay you directly and you use the money however you see fit. Our first benefit is short-term disability, and anybody that's not in management, I would suggest for you to participate with a short-term disability. Basically, that's going to pay you in the event that you're not able to work from off-the-job accident or a sickness. Okay, and we have different benefit periods that you can choose from. The accident policy, naturally, that's going to cover you, and you can cover your spouse and children if you have them. Kids stay on to age 26. It's going to cover from any accident, anywhere, on the job or off the job. Kids at school, and there again, the kids can stay on all the way through college. All right, and then the hospital is really popular because, especially with the Florida Blue, y'all have a pretty good copay or deductible that you have to meet. And with our hospital supplement policy, you can go up to as much as a $2,000 initial first night in the hospital benefit. And then it has other benefits there that helps you with MRIs, x-rays, things like that. And then down below that is the cancer benefit. And it has a growing benefit. Starts at $4,000 for being diagnosed with internal cancer, and that benefit grows by $500 a year that you have the policy for each person that's on the policy. It caps out at age 65. And then next is the critical care policy. That's heart attack, stroke, bypass surgery, stuff like that. And a lot of your heart problems are caused from stress. And as everybody knows, there's a lot of stress in our whole society today. So you might want to take a look at that one. The vision, Aflac does have a vision plan. It's different than the Advanica plan that y'all have. And in the fact that we pay cash directly to you, you can use it along with the Advanica plan if you want to, and actually come out okay on the deal, depending upon which option you choose. And then we also have a dental. Now that's full-time or part-time employees based off of your dental needs, because Guardian is a great plan that they offer. But even when you get to the age that you have to start using or having crowns and major stuff, no dental plan is going to pay 100%. And some of that stuff is very expensive. And then also we have life insurance. You can cover yourself, your spouse, kids, and we have term and whole life. Okay? The benefits are paid directly to you, and we also, on the cancer and the accident policy, we have wellness benefits. The accident policy gives you $60 a year for a single wellness exam, regardless of how many people's on the policy. It pays once. The cancer benefit it actually pays $75 per person on the policy. And if you have kids, the kids are free on the cancer program. It does not cost extra. So if you cover yourself and you have even 5 or 6 kids, it doesn't matter. They can be covered at no cost to you. And everybody gets a $75 wellness benefit. And the 24-hour coverage on and off the job. And like I said before, the coverage is portable and it stays the same rates. Benefits are guaranteed, renewable. And most of our plans come under the Section 125 pre-tax program, and therefore you're saving tax dollars. So there's my contact information. Everybody there is, the easiest way to get a hold of me is the cell phone, shoot me a text, and look forward to hearing from you.
Chip, do you have anything else to add to that?
Well, no, I just think that, basically, Scott, our contact information is included in the packets. If anybody has any questions, issues, problems, concerns, they can reach out to us if they have a specific question regarding anything that we mentioned, prescriptions.
Okay, thank you, Chip. And Tam, before we turn it back over to you, guys, I just want to, acknowledge, I hope you will acknowledge and realize what Tamara and Angela and the organization has done for you. You have a lot of decisions to make here on these benefits, and the reason is they've worked really, really hard to give you a lot of different options for your benefits. Unlike a lot of other corporations that don't even offer health insurance, they're offering a full range to you. So I hope you guys appreciate what they're doing for you. I know it costs money and you have to think about each of these things, but they're great benefits and I hope you'll take advantage of it. Tamara?
Thanks, Scott. Well, I hope everybody was able to follow along. I know this was a new way of doing things, so feel free to provide some feedback to me, those guys that participated. Please let me know, especially if you had employees trying to gather around a computer to watch. Let me know what worked and what didn't work. Also, please encourage employees that were not able to watch this presentation. We are going to put up the link to the recording of this presentation. It'll be on the Infinity homepage so they can access it. And the printouts will also be on Infinity so they can look at them and read through them, share them with others in their household that might be helping them make decisions or they're making decisions with. So that wraps it up for today. And unless anybody has any other questions. And I think all of the questions in the chat section have been answered. If there's anything new that comes up, don't hesitate to reach out to Angela or myself, and we'll get answers as quickly as we can. And remember, you do have Clemens Company's contact information. Chip is an awesome resource when you run into a problem or if you have a question about how a benefit works or what should be covered. And Scott and your team, thank you for all your help putting this together. And I think that wraps it up for today.